Hi, my name is Katherine France. I'm an oral medicine specialist here at Penn Dental Medicine. I'm an assistant professor in the dental school and a provider at the Penn Dental faculty practice. Proud to be an alum of this program as well as our oral medicine specialty training program, and I've been here as faculty for about 6 years now. So dry mouth can be either a subjective or objective finding of less saliva than would be either normal or expected. So by subjective, that means patients experience the feeling that they don't have enough saliva in their mouth or the feeling of dryness in their mouth. And that may be because there's a change in either the quantity of saliva or sometimes if the texture or other factors about the saliva change, you can feel like you're missing something even if the true quantifiable amount may be the same that it otherwise would be. Objective would again be more that we can determine a clear decrease in the amount of saliva for some reason. So I think one thing that people naturally associate, and I can see why they think this, is that everyone's saliva would decrease as they age. Now we do know that things like skin gets drier and eyes get drier, but actually the studies so far have not shown a clear decrease in saliva that's age dependent. It seems to be a lot more dependent on the person and other factors. Another thing that people worry about with dry mouth, which again makes perfect sense, is that they think that there might not be anything that they can do about it, that this is just something you have to live with. But I'm happy to say that we do have a number of different approaches that can at least be tried to provide some relief or even add some additional saliva to somebody's mouth. And then another thing that I think people associate with dry mouth a lot is what the cause might be. And maybe they think it's random or that there's no discernible cause. Actually, we do know that one of the most common causes of dry mouth is medications, especially having more medications. So one medication, you have a risk of having dry mouth, but as you get to 3, 4, or even more medications that you're taking, really regardless of what they are, you have a significantly higher risk of experiencing some level of dry mouth. So it's always going to be a multifactorial approach, looking at can we discern any clear causes, things like could there be a medication that's really highly associated with decreases in saliva, and is there any possibility that that could be switched? Is there anything else going on in your mouth that may be a drying factor, and is there any way we can adjust that? So there's a number of things that patients can do at home as well to try to increase the level of saliva or moisture or even comfort in their mouth. Things like drinking water throughout the day regularly, but also other things that patients can do to try to stimulate salivary flow and hold on to it as much as possible. We do often talk a lot about external products that patients can use to try to help with dry mouth of various different formulas, rinses, lozenges, gums, different things like that. And then there are prescription medications as well that can sometimes be used, if appropriate in a patient's situation, to consider truly adding more saliva to their mouths. The best thing to do is to come see one of us and to get an evaluation. We in oral medicine have specialty training in treating dry mouth as well as any other adjustment to the salivary gland, including any kind of infections or growths of the salivary gland or any other abnormality, which of course could always also be contributing to a patient's experience. But we also have quite a few different approaches, as I mentioned, that we can try, and so it's always worth coming in and having that conversation. Sometimes it's a question of trying one thing and then trying another thing, but making sure that we have really evaluated all the possible contributing factors and provided as many different recommendations as we need until the patient can get some relief.